Welcome, Dow Wellness friends, to the Healing Hour. We are here today with Albert Vaca and Sally Gulubov. Is that correct?
Golubov, yes.
Golubov. Thank you. And we are here with Sally Gulubov. We are going to be chatting tonight about metabolic syndrome. So I will be your host tonight. You also have online with Facebook Live, Leah Jonas, who is our operations director. So she will be answering questions that you have and passing them over to our team. We would like to ask that you please hold your questions until the end so that we have an opportunity to discuss all of the material that we do want to cover, and we will be sure to get to your questions as quickly as we can at the very end, okay? So with that, I just want to explain a little bit on the background of this. If you've never heard of metabolic syndrome, you're probably not alone. I certainly myself didn't know that very much about it. It's a term often used in medical journals and also doctors speak. It's something very familiar to doctors. But what I do want to share with you is it's very important for you to know about this topic tonight. And we are so fortunate to have both Albert and Sally here to really break this down for us. They were telling me how, according to the Journal of American Medical Association, 1/3 of Americans actually has metabolic syndrome, which is also referred to sometimes as Syndrome X. So today we're going to be talking about what this mysterious syndrome is and why we should educate ourselves about it. And we have, as I said, a lot of material to carve out before the end of this evening. So let's get started with both of you. If you can share with us exactly what metabolic syndrome is and why this is even a thing. Like, why do we need to know this as individuals?
Well, metabolic syndrome is actually very common around the world, but definitely in the United States. But it really is not a disease. It's basically a cluster of risk factors that can eventually lead to diabetes and cardiovascular disease. So then we're definitely going to go into what those risks are. But it's basically a cluster of risk factors that many people don't even know that they have. So.
Okay, so how would I know that I have metabolic syndrome then?
There are 5 factors you want to look for. One of it being like central obesity. That's kind of the more prevalent one. You can look at somebody and go, okay, they're kind of shaped like an apple versus shaped like a pear, and so you have that kind of visceral fat going on in the middle. So that can be one factor. Low blood pressure, or I'm sorry, high blood pressure, right? So if you're already having high blood pressure, if you're having blood glucose levels, if you suffer from hypoglycemia, you're getting really tired, and you get after meals, or it's been a long time since you've eaten, you're starting to feel really tired, then you notice that your blood glucose levels are a little low. That can be one as well. Your cholesterol levels, particularly your happy cholesterol levels, are on the low side, okay, which you can't really tell for that matter without a blood test, but those are some of the things you want to look for. So blood sugar, cholesterol, particularly the triglycerides and the HDLs, and then the central obesity, the visceral fat around your waist.
So how will an individual know? Let's just touch on the obesity factor. A lot of people do gain weight in that area. How would you start to realize this is not just a weight gain? This is something that potentially is much more serious.
Well, they state if you look at studies, men usually have a waistline that should be larger than 40 inches, and for women it's 35 inches. So that's kind of a good sort of baseline as far as figuring out when it's too much.
Okay, so if you're exceeding that, then the question marks start going up for you. Okay.
Yeah, but we also got to realize that just because you have obesity, for instance, that apple shape, or your waist size are larger than necessary, than can't be there, that doesn't necessarily mean you don't have it or do have it. There are plenty of people out there that have central obesity that are totally okay with the other risk factors.
Right.
But the deal is that you got to have 3 out of the 5.
3 out of the 5.
3 out of the 5 that you're looking at. So blood pressure, triglycerides, HDL levels, and fasting glucose, along with the central obesity as well.
Okay.
So 3 out of the 5, and that's when you're in the kind of danger zone.
Okay. Now, is this something that only impacts adults, or could it also impact adolescents?
It definitely can impact adolescents, even kids. It's because obesity is so prevalent in this country, in children, unfortunately. But apparently 1 in 10 adolescents has metabolic syndrome, which is actually kind of scary. And a lot of it is due to the fact that they eat these, nutrition diets, high in fat, juices with a lot of sugar, sodas with a lot of sugar, and they're not getting the nutrients they need. And so they become obese. And then other things lead to like high blood pressure and high cholesterol. That's actually being seen in adolescents now. So that later in life will lead to diabetes, cardiovascular disease. So it is actually a very serious thing.
Okay.
The one thing that shocked me the most when I was kind of searching more about metabolic syndrome in regard to small, adolescents and teenagers, is that when you get it at such a low, if you have these factors at such a low rate in years, that you can actually start, you may not see them. Let me start over. If you get them early on in life and you have that central obesity and you're not eating very well, a lot of processed food, lots of sugars, then you're setting yourself up for, instead of being a teen, you're going to get them in your earlier young adult years. So what they used to find people like, okay, yeah, you might be having these factors early on, but they still didn't see them past 40 plus or 60 plus. Now they're seeing them in their 18 to 30. And so that creates a whole gamut of problems, not to mention financially, because people that have metabolic syndrome are more than doubling their amount that they spend on healthcare at the same time.
Oh, I'm sure, because then once you find out you have it, the care to try and reverse that process must be expensive.
Oh, absolutely. But not only that, but if you're not doing the things to reverse it, you're actually spending money on medication. Right? And then you get involved in the healthcare process there too. So that's kind of hard.
And just out of curiosity, do we know, is it here in the United States that we have the highest rate of it? Or is there data on that?
It's a good question. Actually, I don't know. Albert, do you know?
I'm not sure. I don't know. The one thing that really stuck out for me is that that 30% of Americans have metabolic syndrome.
Yeah, that's pretty high.
Judging by our standard American diet, amongst most countries, I would think that's on the higher side more than other countries.
I agree. Yeah.
Okay. Now, what about the difference between women and men? I read an article where supposedly women get it at a stronger rate than men. Is that true, false? What are your feelings on this based on your research?
We've heard different things. It's funny because you look at different areas of study and you're seeing different things. You see it a lot more in men. You see it a lot more in Latinos. But there are factors of women. Just to be specific on your question, in women, particularly, the short answer is hormones. Because postmenopausal women, that can create more of an issue because they tend to have more central obesity after menopause. Okay, so that's creating more adipose tissue around there, taxing the pancreas, taxing the liver, taxing their spleen organs, in Chinese medicine, that is. So that's where it comes into play with more women.
Okay.
Yeah.
And I would like to circle back to that later because I know we're going to be talking about diet in a little bit, but I think it's important that we have a reference of things we could be doing then, especially as women. If we know this is something that we're faced with postmenopausal, how we can start addressing this before we even become premenopausal so that we're laying down a framework that's going to better serve us later in life. And likewise for men, as they're aging, how can you lay down that framework better? But before we go into that, I did want to ask you because just for the audience to know, they were explaining to me that PCOS is tied into this as well. So can you please share with everybody how PCOS actually fits into the scheme of this then?
Yeah, so we've seen I see a lot of patients that have PCOS, and we're seeing a lot of younger women being diagnosed all the time with PCOS. I get a lot of patients like this. And the thing is, PCOS is polycystic ovarian syndrome, which means a woman is making lots of cysts in her ovaries, which can lead to infertility as well. So it's an
insulin. How does she make them, Sally?
Say that again?
How does that happen? How does she make them in her body? Do we know?
The cysts?
Uh-huh.
Yes. So women that have PCOS have insulin resistance, and by having insulin resistance, the ovaries actually produce more testosterone, and so then they create these cysts, which, and also other symptoms of PCOS are having a little more hair on the face, acne, and issues with their periods. And so there's a lot of women that are being diagnosed with PCOS. But the question is, did the PCOS come from metabolic syndrome, or did metabolic syndrome cause the PCOS? And that's kind of an interesting question, because let's just say you're a teen and you're a girl and you go into puberty and you were already overweight. Did being overweight then cause a PCOS, or the insulin resistance that caused a PCOS? Or what if you're somebody that's not overweight and then you have PCOS? You know, did that eventually then cause the metabolic syndrome? Because other symptoms do come from women that have PCOS. And they've actually found that women that have PCOS have 11 more times the chances of getting metabolic syndrome and having diabetes. So it is a serious issue and very common now with young women. And the way Western medicine treats it is they love to give birth control pills to kind of shut down everything and control the PCOS. But then, you know, eventually these women that want to get pregnant sometimes find that they have issues with fertility because they've been on birth control for so many years. So that's, you know, that's something that we know about PCOS.
Mm-hmm. Okay.
Nice explained, Sally. No, Sally nailed everything that I was going to say. And then some.
Okay.
When you're looking at metabolic syndrome related to PCOS, I mean, it's interesting because a lot of people that we see for PCOS, they're coming in here to look to get pregnant. Mm-hmm. So when you're looking at risk factors of just having overweight, just being overweight, just by losing 5 to 10% can relax the muscles enough so that your ovaries can work more efficiently. Mm-hmm. So even if you have PCOS, you can still get pregnant, but you just got to allow your ovaries in order to make them strong enough to do their work.
Mm-hmm. Mm-hmm. Okay. Yes. So let's talk about overall how if I had this, how could I lower my risk for it? What are ways that we can lower our risk?
First things I think of are diet and exercise. Those, you know, just those two right there are big factors. You know, so if you're looking at diet, for instance, you know, there's anti-inflammatory diets that we prescribe to a lot of people in Chinese medicine. Which basically says, you know, cut down on the coffee, cut down on the dairy, the sugar, the nightshade vegetables that create more inflammation. One of the things that I, you know, in my research with doing this and in my clinical practice is that we have a lot of inflammation and a lot of insulin resistance. And just by taking care of the diet, that can take care of both of those, so that you are, your body's working a lot more efficiently, and you're losing some weight, and your heart is working less hard, and so forth. Mm-hmm. So the anti-inflammatory diet would be one. The keto diet. If you're looking at the keto diet, it has, you know, very low carb, right? Mm-hmm. Very, very low carb. You're looking at high protein and high fat. Mm-hmm. So that way you're getting higher amounts of energy in order to get more energy as you go through. And then without the carbs that will increase your insulin resistance going on with that. So those are a couple of things that I think of with diet. In regard to exercise, you know, your body uses sugar. You know, your body takes in the sugar and uses it, but it uses it for muscle, it uses it for energy. It's what you need. Mm-hmm. But if you have excess sugar, that is, you know, basically your liver can only metabolize so much. So it gets all this sugar, and all of a sudden it's like, okay, what do I need to do? What am I going to do with the rest of it? I can't take it anymore. Let me shut the gates. Mm-hmm. And so now the sugar goes where? It goes into your bloodstream, right? Mm-hmm. And so that's when the insulin resistance starts to begin. Okay, that's the mad cycle of that going on. So it tends to show that the more muscle you have on your body, the more insulin will be able, or the more sugar and insulin will be able to work, the glycogen in your body will be able to be used up, so that there's a lot less in your bloodstream and that your liver can take care of it.
And what type of exercise is recommended for individuals?
I personally like strength training. I think that's one of the best things that you can do for your body. But honestly, anything that gets your heart rate up and circulation going is beneficial. I remember actually Matt said this in the last episode that we were with. He's like, do something you enjoy, because we can prescribe something to you, but it's not going to matter, if you don't like doing it. I mean, I could tell people to do strength training. I could tell people to do super slow training. I could tell people to do CrossFit, whatever, do yoga, do Pilates. But if the only thing they can do, the only thing they like to do is go walking their dogs in the evening time, then go walk your dogs. Do it briskly and get that moving. Go ahead, Sally.
Yeah, no, I was just going to say walking, which is something I personally enjoy too. Sometimes that's all people can do or they enjoy doing. So go on a nice brisk walk every day if you can for 30 minutes. And that makes a huge difference.
Yeah, I always find it funny. I feel like walking is so underrated because perhaps it seems so simple, and yet it's so good for individuals.
It is so good.
Just in the stress relief alone, I think that's a huge factor.
Yeah.
Your body's under stress, it's going to hang on to fat. Because like, when am I getting my next meal? I'm all stressed right now. I better hang on, store this for a time that I do not feel safe.
Or we have that dialogue in our head. Oh, 1 more hour. I just need to get this done. I just need to get this done, and then I'll go do it. And now you've thrown it the block.
Yeah, definitely. And when the other thing I think about when it comes down to eating, eat mindfully. Too many people, grab something to eat and go, and whether it be fast food or maybe it's a home cooked meal, but all of a sudden they're in front of their computer during work and eating, or they're in their car and they're eating on the freeway, or they're eating while they're standing up doing things. It's like, take some time for yourself and honor yourself in order to do that.
Okay. So now that we're on this topic of eating, let's go a little bit more into, I know you mentioned some different plans that are very healthy, but let's talk about the types of foods, the type of structure somebody wants to create around their eating habits that will help to improve this as well.
I mean, definitely you want to eat, having a whole, eating a diet with variety of foods, you want to definitely eat like whole grains, lean meat, vegetables, fruit. I mean, it's not about being on a restricted diet, but I think just eating good food, organic obviously is always the better food, or local, go to your, go to your farmer's market and buy locally, but eat fresh food. Look, nowadays we are all so busy that it's hard to get home and cook a meal after you've worked all day. And so there are different options on things that you can do. There are definitely some companies that make really good food with good ingredients, and if that's easier for you, then you for sure should do that. I think we're going to go into a topic on where to get these foods and things like that, and places like Whole Foods, Trader Joe's, yes, all of these things are good as long as you make sure you read your ingredients. Make sure that what you're eating or you're buying doesn't have a ton of sodium, a bunch of sugar. So as long as you're eating good food, even though it's already prepared, I think that's absolutely fine. But we have a lot of options. We're lucky that we live in a time where we can actually choose good, healthy foods and make it easier for our lives because we're all so busy.
Okay.
There's a group called Environmental Working Group that every year they put out a list of the dirty dozen, the foods that you don't want to buy, farm raised. You'd rather get them organically.
Yeah, and they make it cheap. You can carry around in your wallet.
Exactly. It's small enough to do that. So there's the clean 15 and the dirty dozen. And I think that's always a good thing to kind of have in your pocket or have on your phone. You can look up right at the store and go, should I buy these organic strawberries or should I buy, these non-organic strawberries? Always buy the organic, by the way.
Yeah.
Especially for berries. Yes.
Especially for berries.
Yeah. And so some things you want to watch out for. But, eating fresh, Sally mentioned the farmer's market. I love that because part of that is too, you're eating in season.
Yes.
So when you're eating in season, these are the foods that are really good for you. So right now you'll see that like the pears are out there a lot, and pears are fantastic for nourishing the lung and helping to nourish fluids in your body. So great for colds and coughs and sore throats, and so that type of thing that you can do. The pumpkin squashes, the spaghetti squashes, stuff with a hard shell on the outside and juiciness on the inside is so good for you. And I'm a big fan of soups personally, so just to get all the vitamins and nutrients out of everything you're cooking. But the slow cooker is amazing, honestly. because you can put stuff in there and, you know, have stuff for a couple of days too.
What are your thoughts? You know, you just mentioned something that I thought was interesting. You were talking about with squash and how it has the hard outer core and then the juicy center to it. Now, what are your feelings about how, you know, Trader Joe's does this? I know Whole Foods does it too, where they will pre-cut these vegetables for us. So we're not necessarily having access to those outer nutrients at the time we're going to prepare our food. Does it make a difference, or is the difference so subtle it doesn't matter?
I mean, I think it's still fine. I mean, I don't think there's a whole bunch of a difference. I think as long as you're getting those good foods, and even though they may be cut up for you, I think go for it. It's still good for you.
Okay.
Yeah, I'd have to agree. I'm, you know, I'm not a big like proponent of so many rules in my life, because the harder somebody has to follow a rule, the more they're going to break it.
Yes.
It's just, there it is. Yeah, exactly. It's like, there's my wall, you know, let me step over. Let me see how close I can get to that fence and still be okay. You know, no, I just, you know, just go ahead and, you know, eat well, eat organic and pesticide free as you can. You know, lean meats, good fats and proteins. You know, in regard to this, you know, metabolic syndrome, think low glycemic as well. So if you are going to do some carbs, you know, do the low glycemic. So instead of like potatoes, do sweet potatoes, for instance. You know, white corn versus.
What does that mean, low glycemic? Give some.
Low glycemic means that the sugar content will go into your bloodstream a lot slower.
Okay.
It's like a slow burn sugar versus a really fast, simple sugar. Like it's like a white rice or like a bagel, you know, a baguette, French bread type of thing, which smells delicious, but you know, it's gonna go quickly through your body, versus like a brown rice or a sweet potato, you know, things like that.
Okay, so that's going to be our low glycemics. Okay.
Mm-hmm.
Now Sally started to touch on this, and I do want to talk about it because, you know, usually individuals are so much on the go, and it has become a norm of life to want to go for fast food places, convenience places. If we had to sift through and be able to make those decisions that are normal decisions to make of where do we go to get the food, if we're literally need to get it now and take it home, we're just exhausted, we've had a long day, we're exhausted, you know what, there's not a Whole Foods or a Trader Joe's nearby, although we're fortunate here in Los Angeles to have so many. There's a lot of other cities in the States that don't have access to those things. So what does an individual do in that case? How do they, if they didn't pre-plan their meals, how would they address this with convenient foods?
That's a good question. I mean, if you live in a place where the quickest thing is a fast food place, then, you know, fast food places now are starting to address these issues, thankfully. They're starting to offer some other options. So I always tell my patients, look, if this is like you have to go through a drive-through or whatever, choose the best thing and in the menu if you can, you know, that's maybe not fried or greasy, or perhaps maybe a salad with some protein. I mean, now they're offering a lot more options. I still think, you know, obviously fast food is not the best option, but if you have to, then be smart about what you choose within the menu that they're giving you. And now I find that they're offering more health options than they used to before. So that I would just say make smart choices, even if you're kind of stuck with whatever it is that's around you and convenient.
Yeah. Okay. Albert, did you want to add to that?
Yeah, a couple things. One, start to be comfortable with being hungry. The reason I say that is because, oh my gosh, I'm hungry. I need to eat something now. And all of a sudden, like I'm in the fridge, you know, it's like, are you really hungry? I mean, can you have some tea? Can you drink some water? Has it been long enough where your body has actually used the energy that you've used? I mean, we live in this environment in this first world country that like you can grab anything on any corner. You can have something delivered to you in 30 minutes or less. And so your food is always at your beck and call. And so we got to decide, like, are we really hungry? Or are we eating emotionally? You know, are we eating just out of convenience? Are we eating because it's a habit? Because I need to watch my favorite show with this, you know, pumpkin bread that like cooked last week. It's delicious, you know. So that type of thing. You know, Peter Dedman, actually, I stole that from Peter Dedman. He's an acupuncturist that's helped write our textbooks, and you know, everybody's gone and seen him. But he's like, be comfortable with being hungry. I think about that with intermittent fasting. Intermittent fasting can actually be,
what is that?
intermittent fasting, basically the basic breakdown is pick a period where you're not going to eat. So maybe you eat from 8 a.m. to 6 p.m. and then you don't eat anything until the next morning again. Okay, like 12 to 14 hours. So, okay, can you have my dinner at 6 and not eat anything before I go to bed? Is it possible for you? I mean, you got to determine what's right for you. But do you need to eat first thing in the morning just because I'm up? Not to say that breakfast is not important. I definitely believe it is. And I'll go on another tangent on that in a minute. But that's the intermittent fasting is basically that. So what it helps to do is, you might feel a little bit hungry, but can you have some water during that time? Can you drink some tea before going to bed? And then I'm like, okay, I feel fine. I'm okay. And then what that basically does is increases increases your body to be a fat burning machine. So starting to get more of that visceral fat that goes on in there, not just the outer layer, but the visceral fat, the stuff in the liver that's just like, fatty in there. And that's what the harmful stuff is. And that's why the intermittent fasting can be very important.
Okay.
What was my other tangent? I forgot my other tangent. Anyway, we'll come back. I'm sure
it comes back to you. Bring it back to us.
Absolutely. Oh, here it is. I found it. Another thing that Peter Devin, and he mentioned, because we've all learned Chinese medicine and the classics and things, but one thing he mentioned in this past lecture was eat during the morning, eat like a king in the morning, eat like a merchant in the afternoon, and eat like a pauper in the evening.
Yes, I've heard that before.
Right. Yeah, and he made up a whole bunch of other funny ones too. But the basic premise is that your digestive system is working most efficiently in the morning and the afternoon, and not so well in the evening time. Okay, so for those people that have it opposite, they have no breakfast, a medium lunch, and a giant dinner before going to bed. That's creating the opposite effect. Right. So you're taxing the stomach and spleen stomach channels, the organs, and they are not working nearly as efficiently. You're probably going to end up gaining more weight that way than the other way.
Interesting. Okay. I hope people are taking notes. I've got a lot of people online here listening, so hopefully this is serving them well. Next question for you all. Let's just talk about, so let's say these lifestyle changes aren't enough. How is this treated in Western medicine versus in Eastern medicine, Chinese medicine?
Well, I think Western medicine takes the approach of using sometimes medication. So, obviously you have high blood pressure, you take, medication for hypertension, you have high cholesterol, you usually get statin, so there's medications to deal with this. In Western medicine, as far as Chinese medicine is concerned, we do look at it from a different point of view. We offer, obviously, acupuncture treatments as well as herbal medicine to treat each individual person. And that's, I think, the beauty of Chinese medicine is that we are able to customize and individualize the treatment for each particular patient, because you might have two patients that have metabolic syndrome and are two completely different people. They present differently. Their body structure is different, and we look at the body in a different way. And so we find the Chinese, medical basically diagnosis that fits a particular person. So we treat them with specific herbs for that particular presentation. And so we treat everybody differently because every person is different, even though they may be diagnosed with the same syndrome. So again, Western medicine, my understanding is mainly they will talk about diet, they will talk about exercise, but usually there is medication involved in treating it. And we just kind of look at the whole person. And we also obviously include diet, as well as forms of exercise, or like Qigong, Qi cultivation, to help them also with losing weight. And we have very specific Qi practices that actually focus on weight loss and stress and, other things.
And how often if a person is starting to do a Qigong practice for weight loss, how often would they practice that? Is that a daily practice? Is that several times a week? How do you structure that?
Albert?
Yeah, sure. You're well, you know what? Maybe I can zoom in on this guy.
Yeah.
Here you go. You see that? There you go.
Oh, yeah.
She's gone for weight loss. That's an example of something that we have here in our clinic. There's self-healing Qigong. There's back pain Qigong, which has a lot of incorporations of other types of forms that we go on. But ultimately, this Qigong for weight loss is a great one because it doesn't take very long to do. So in this, one of the moves is basically, up here, and you're basically acting your whole body, twisting your body around like a snake. It's called swimming dragon. And so that's creating that whole like twisting motion from your whole waist. So now you're almost like wringing your whole body out like a towel, which helps the liver and helps the Xiao Yang systems along the sides and helps incorporate that spleen and stomach, getting get the metabolism rising and making your metabolism strong. So that'd be an install. So your question was how long, how often should I do it? This can be a practice. I mean, I think the whole thing is like less than 15 minutes long. From everything from massaging your thyroid to, doing circles on your belly to massaging your kidneys, doing some other motions. It doesn't take very long at all. So once you get the hang of it, 10 minutes is not a lot to ask for your help.
Okay. Yeah. And for some of our viewers who perhaps are new and might not know what Qigong is, can you go into a little deeper explanation of what it is and, if they need to have some sort of foundation before they start doing it? Obviously, you've shown us now we can do that in our own homes. Mm-hmm. What else can you tell us about this?
I'm sure a lot of people have heard of Tai Chi, right? Tai Chi's, you picture a bunch of older people in the park, they're doing slow movements and it's good for their balance and so forth. It's good for relaxation. All those things are all fantastic and really good. But the difference between Tai Chi and Qigong is that Qigong is, energy cultivation exercises, more with the flow and movement of like 100 movements or 14 movements or 32 movements. But it's specific exercises for specific organs in your body and specific systems in your body to do. So you could do one exercise and go, cool, I can do this one exercise for my spleen. I can do one exercise for my liver. I can do one exercise for my heart. And we prescribe these things to our patients as we go along. So, so we go, hey, do this spleen exercise. I just gave it to somebody, today, as a matter of fact, do this liver exercise because they were super stressed out and they were having side flank pain and they were getting red eyes. And that was something to help clear out their liver and, help them function a little bit better. So,
Albert, you just teased us. Yeah. Now we all want to know what to do when we're super stressed out. Is this something you can show us right now?
Yeah, I could probably show you right now. It's not that difficult.
Okay.
Squeeze back here a little bit.
Are you going to do the liver one?
Yeah, the liver one. I don't know if I can get in here so well, but generally you're standing in there with your hips width apart. You're bringing your hands up around the sides, and you're coming here to the top of your forehead, kind of your third eye area. And then you're taking a step with your right foot for about 45 degrees forward. You can't see my leg now, but you're gonna turn your body over to your right side as you bring your arms downward across the liver, over which is located right underneath your rib cage, underneath your right rib cage. And you're squeezing, almost like pushing it straight downwards. Pushing this downwards down the inside of your leg. You don't have to raise your leg. But down the inside of your leg like this, raise your toe and let it out off the ramp.
So push that energy straight down and out.
Bring it up, okay, over, push it down the liver, down the inside of your leg, all the way to the inside of your knee, and then outwards, out that big toe like a ramp. And you do that on both sides.
And how many times do they repeat it?
6 on each side or 3 on each side. If you can get that energy, just kind of doing that. That's kind of the first part of it. But that's the one I feel like you're just literally pushing, you're squeezing the funky, toxic juice out of that liver, all that stress, all that, just squeezing it out and going down that liver channel along the inside of your leg, all the way out your big toe.
And this is by the way, this is the video of self-healing Qigong. This is a great one because it actually.
He's doing that right there.
He's doing it, right?
Yeah, he is doing it.
Yeah, this is the one where it actually goes through each organ system and teaches you how to clear all the organ systems. So the liver one's in here, but this is a great DVD. And one more thing to add about Qi cultivation is that it really doesn't matter what age you are, or even if you're someone that is in a wheelchair or can't walk or stand. All of these movements can be modified so that you can do them at your own
your own pace, essentially.
Your own pace system, yes. Yeah. What makes you comfortable. So you don't have to do it exactly the way it's it can be modified, and it's still very effective. And that's what I love about Qigong, is that anybody can do it.
I love that too. And because we're all at different places in our lifestyles, so it's nice to know when you have something accessible. And I love things that we have the opportunity, we can do them at home too. Because sometimes our schedules do get, so busy that as much as we want to, we can't make it over to a class in time or whatnot. So at least this is something you can pull out in your home and just do it because your body's asking you to do it.
Exactly. And sometimes what we tell patients too, when we do send people home with these DVDs, we tell them you can definitely do this at home. If you need like one session or two sessions with one of us to sort of lead you the first time around, that's also, an option. And then you continue at home with the DVD. But the DVD is very self-explanatory, and it's great because you can do it really at any time in your own home.
Okay, got it. So let's switch directions, still in this theme of Chinese medicine, Eastern medicine. We've talked about what you can do exercise-wise. We've started talking about diet. What about herbal supplements? How do herbal supplements fit into all this, if they do at all?
Well,
so go ahead, Sally.
Go ahead, Albert. You go ahead.
Okay. Herbal supplements, I think Sally touched on it earlier, how any person that comes in as a patient, comes into our clinic is, seen as a whole person. So not everybody's going to get the same cookie cutter prescription.
Right.
I don't care if you come in and you have type 2 diabetes and this person has type 2 diabetes. We're not going to, your prescriptions may be totally different, or they may be totally the same depending on what you have, of course, but it's customized for that person specifically. And so we're looking at everything that looks like, we're looking at different systems in their body. So if their spleen and pancreas aren't working well, if their liver is not working well, if their heart's not working well, amongst the metabolic syndromes tends to be those big ones, then we'll prescribe herbs that are specifically for those systems in their body to help them improve. Right? As well as take into consideration, like, are they stressed out? Are they exercising? Are they having headaches? What is their digestive or bowel movements looking like? What are they doing? Like that. So, all those lifestyle issues that we have to take into consideration as well.
Okay.
So in regard to herbal medicine, we can prescribe them raw herbs. We can prescribe them powder granule form as well to make it more convenient for them. They don't have to cook it. Or patent medicine as well if they're really on the run or vacation or something like that. But we prefer to do a customized formula with our people because that'll give them the best bang for their buck.
Okay. And do we have something that, obviously, we've talked a lot about how this is very customized for each individual. Do we have something that is supportive on a day-to-day basis that we would recommend to them as a product to take that's, supporting the lifestyle overall, or is this truly customized that we need to pay attention to?
Well, I think we can do both. I mean, we definitely want to do a customized herbal formula for each individual person, but there are some things that we do offer. One product that we have is called, I'll show you, it's called Be Slim, and that's, I don't know if you can see that, but this is something that we sell sort of like over the counter for someone that is looking to help with weight loss. We have something called Metabolism Boost. So we've got like these supplements that actually help along with the herbs, and it's all natural and herbal as well, but are meant to help support that person through, weight loss or whatever it is that they are going through. So we definitely have these options, and we offer them to patients as well. So I would say Be Slim, Metabolism Boost. I don't know. I think, Albert, did you mention some other ones I think that are specific for like heart, spleen?
Well, I was thinking I was thinking more along, I'm not sure what in regard to herbs and stuff or patents and things that we have at the store. I mean, yeah, I'm not sure. What I was thinking of was spices.
Oh, right, spices.
Let's talk about it. What spices?
Because spices that we can do. There is actually a Dr. Mao's book. Let me see if I can find it.
Oh, it's right there above you.
Yeah. Where, there you go. Secret to Longevity Cookbook. In here, and we don't do them anymore, but there's a whole list of, this is all recipes. This is all recipes, but I don't think we do them anymore. But we had spice kits, and they were specifically like, this are metabolism spice blend, a heart spice blend, and those are the ones that I was thinking about specifically. Like the metabolism spice blend had like, red chili peppers, it had cayenne, it had ginger, garlic, cinnamon, things of that nature. So just by putting those things in there, which tend to be a little bit on the warming side, but they're specifically good for, insulin resistance, pre-diabetics that you can cook with, put it in your foods. Whereas the heart blend had like, fennel seeds, white pepper, parsley, turmeric in there as well. So, I mean, just by adding those little things into your diet, that's why I love soup so much, because you can just throw a bunch of this in there and let it cook on down.
Exactly. Yeah.
You can actually, you can actually cook with a lot of Chinese herbs. So in consultation with your acupuncturist, poria cocos, we'll call fu ling in Chinese medicine, will help the digestive system. Jujubes as well, which is also good for the spleen. That you can throw these in your soups and cook them down.
Okay. And just in reference, so that our viewers know, the cookbook does have the recipe in there for the spice blends. We tell you what combinations to do. So you do have access to that. I will as well try and remember to do, we did an article about this some time ago. So I'll see if I can find that article and republish that in the month of December for everybody, so that they have access to some more details about how to incorporate spices into your cooking that will benefit your well-being too. So we are getting
it's got two pages of all the blends. So everything from heart spice, immunity spice blend, anti-inflammatory, metabolism, cleansing, brain and vision, skin and beauty.
I have to say, I'm a huge fan of this cookbook because there's actually a lot of really good recipes in it too. It was very well thought out. So it's not just giving a list and saying, okay, these are the healthy foods. It actually gives you recipes that are very easy to make. Like I've been part of some of our cooking classes that we've done too, and it's fun. It's delicious recipes versus just being that healthy recipe that you need to have in your meal planning. So it is worth a checkout for viewers. So I wanted to say we are getting close to coming up on the hour. But before we do, can we just do a little bit of a recap wrap up? If you can just readdress for everybody, what are some of the key daily habits that they need to adapt in the here and now? Remind them again of the 5 things to look for that are indicators of metabolic syndrome, and then what would be their next step should they truly believe that they need to go and address this.
Okay, so the 5 are, we had talked about, having sort of more fat around the visceral area. If you're a man, over 40 inches. If you're a woman, over 35 inches is one of them. The other one was hypertension, high blood pressure, basically, high cholesterol, having a low HDL, which is your good cholesterol, and having a high LDL, which is your bad cholesterol, and then your fasting glucose, having that be over 100, that is a bad thing. So and having 3 of those things would already make you, would give you a diagnosis of metabolic syndrome.
Okay. And then let's talk about what are the daily tips, preventative tips that we can be doing to hopefully not have to face this one day.
Watch your eating habits. Don't think about so much about what you need to take away. Although getting sugar out of your diet would be awesome, and I think that's a huge factor for most people. That takes care of inflammation and insulin. That's a huge one, I think. But so besides taking out sugar, think about what you can add to your diet. because just by popping one out, your body will drive you crazy if you don't add some good things into your body to nourish it. So, you know, low glycemic foods, lots of antioxidants, red berries, different colors on your plate, you know, eat mindfully. And then the other thing was get your body moving. Move every day. You know, I don't care if you want to just do jumping jacks in your room. If you stand there and bounce for 3 minutes, you do the swimming dragon that goes around in a circle like this for a couple minutes. The liver one we showed you. Just find something that you like, find something that you can do, and develop a habit, because that's really where you're going to get the most bang for your buck with that.
Okay.
And I would add one more thing: control your stress levels, because when we're stressed, again, we're in fight or flight mode, right? And so our body wants to store that fat because we're trying to survive. So I would say really find outlets for your stress. I mean, we all have stress. It's not like, you know, stress goes away, but it's how do you deal with stress, you know? And people have different ways of dealing with it, whether that's, you know, coming in for an acupuncture treatment for 30, 40 minutes and having this, you know, time for yourself, doing yoga, walking. We have some really great meditations. Dr. Mao has one that a lot of people love. It's the stress release meditation. So meditating, I mean, finding whatever, journaling, whatever helps you release stress is really important, because the more we hold on to that stress, the more we hold on to, you know, all of these things that are affecting our health. And so, so it's really important to know how to have outlets to release your stress.
Okay. Thank you both. Okay. We are going to open up to questions. If you do have questions, I feel like we covered everything so thoroughly, but we are always open to questions. So if you do have questions, please, those of you that are on Zoom, you are welcome to put in the chat box your questions for us, and we can see them right here with you. And then for those of you on Facebook Live, Leah is on there with you. So if you want to, in that chat box, put your questions, she will pass them over to us. While we're waiting on that, if the two of you would be so gracious, we have a question that actually does not have to do with tonight's episode, but one of our individuals that follows us closely did have a question that she emailed to me from Australia. So she said if anybody could answer this tonight, she would be very appreciative. And she said that she's experiencing low energy and has oily skin and hair since she was about age 10 with whiteheads. Does this mean that there's dampness in her spleen? We get every type of question.
I would say yes, it's possible that there is dampness for sure. Did she mention any digestive issues?
I do know from the past, yes, she does have digestive issues too.
Yeah, definitely digestive issues can mean that the spleen is weak, and so it needs to be, you know, strengthened for sure. So yes, definitely dampness is something that we talk about a lot in Chinese medicine, but there are things that actually make dampness worse, like sugar and dairy. But it is a weak digestive system, which in turn in Chinese medicine means it's a weak spleen. And so we want to make that spleen stronger. And you can do that with herbs. You can do that with acupuncture. You can do that with diet, you know, so it's all about changing your diet. So maybe there are certain foods that she's eating that are not helping her condition. And there's definitely good spleen foods that, you know, that she can eat. Sweet potato is a wonderful thing for the spleen. So yeah, I would say there's probably some dampness there. I don't know, Albert, do you agree?
Yeah, just, you know, it gives you like the oily skin. You get the whiteheads going on there too. It depends on how the person is also, you know, if they are overweight. I mentioned that they were overweight a little bit. So that can have a preponderance of that spleen to be a little bit overtaxed. And so when that's overtaxed, the systems just don't move as efficiently. So again, you know, get moving every single day and do something that makes her happy.
Okay.
That goes a long way.
Thank you both. I appreciate it. Okay, let's see if we have questions that are coming in from others. We have many thank yous coming in.
Thank you for being on.
Yeah, thank you for being on and listening to
us. Yeah, I think that's it. Maybe before we go, Do you want to just leave them with any great tips as we go into the holidays?
Watch your sugar. I mean, look, it's the holidays. You've got to enjoy food. Yes, there has to be a balance to everything, and Chinese medicine is about being balanced. But I'm also a believer of, like, you can't restrict yourself on everything. So it's the holidays, enjoy, but also be mindful of what you eat. There is a lot of sugar, usually around Thanksgiving and Christmas. So you can have a little bit here and there, but don't overdo it, because you'll definitely feel the effects of it afterwards. So just be mindful of what you choose to eat.
Okay, thank you. Albert, did you want to add to that?
Uh-oh. Did we lose him?
Nope, there he is. He's back.
There he is.
Albert, can you hear us? Oh, Albert froze.
Albert froze.
Oh.
Oh.
That's a sign that we're up at the hour. Well, I apologize that Albert froze on us. Hopefully he will come. There he is. Okay. You're
There
back with us. I don't know what happened. We were laughing. We were like, boy, is that a sign that we're done? Did you have any tips for us?
Oh, there we go. Oh, I'm back on now.
You can hear us?
Can you hear us, Albert?
And Joy, I can hear you. Can you hear me?
Yes.
I can hear you, yes.
Mm-hmm.
Okay, I'm going to talk, assuming you can hear me.
Yes.
Enjoy your community, laugh a lot, hug a lot.
We love hugs. Actually, we all get to hug on Sunday together.
That's right. We do get to see each other on Sunday.
Yes. Okay, well, I just want to thank both of you so much for being on with us tonight and sharing such fantastic information. I know for myself that was really educational. It wasn't something as a topic that I was very aware of, and I think that for others, whether they were on with us live now or if they're watching it in replay, it really is fabulous information to be aware of, because I have a feeling even if we're not experiencing it ourselves, we probably know somebody that is undergoing this or in the stage of this.
Definitely.
Also, before we go, I just wanted to share with all of our viewers, next week is going to be a double dose of wellness education. We have on Monday, Dr. Mao is going to be on with your Dr. Mao at 5 p.m. Pacific, and he is going to be talking about the wonderful holiday eating habits and how to just be gentle with yourselves and, you know, enjoy, and how you can enjoy still in very healthy ways in terms of practices. And then on Thursday, we have Dr. Dow, who's going to be chatting with us on our women's health platform. And he's going to be chatting all about stress and how not to stress yourself out during the holidays. So we just like to tackle it all. And then later in the month, of course, we have our telestudy for December, and then we will be back with the Healing Hour in the final week of December, and we'll be talking about healthy eating plans. So how tonight, when Albert and Sally were referring to things like the keto plan and the paleo plan, they will be going into more details with that, and that will be Francis and Suan on with us for the month of December. So again, to both you, Albert, and you, Sally, I just want to thank you so much for sharing with us tonight. We are so appreciative of you taking time out of your schedules, and I know I enjoyed this, and I hope everybody else did too. So thank you so much for tonight.
You're welcome. Thank you for having us.
You're welcome. Thanks, Tiffany. Thank you for everybody out there. Have a great holiday, everybody.
Yes, happy holidays.
Thank you. Take care. Bye.
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 Yeah, thank you to you too. Bye.
Yeah, thank you, Leah. Bye.